You know, frontline healthcare workers have had an incredibly difficult year. The COVID-19 pandemic, coming after the uncertainty that had already been created by Jason Kenney and the UCP with their plans to inject so much more private profit in the midst of our public healthcare system. Even before the pandemic, I was hearing from healthcare workers.
So I'm Taysin Lada. I'm a pediatrician. I have a Master of Public Health, and I'm an assistant professor at the University of Alberta. It was actually really a terrifying time when COVID hit. I think the whole community was scared, but I think in particular healthcare workers were scared to go into work every day because we weren't sure whether we would become infected and whether we'd bring that infection home to our families.
My name is Kathy Bomester and I work at the Peter Lougheed Hospital in the ICU as a critical care nurse. I'm a registered nurse by trade. When I first heard about COVID-19, I know that was in December of 2019, it was hard to understand what we were going to be going through because the only frame of reference we had were pictures from New York of the ICUs there and people dying.
My name is Mike Parker. I am the president of the Health Sciences Association of Alberta. From the front lines of healthcare, they've done everything they've needed to do to be safe. They've done everything they needed to do to protect Albertans. And it just lingers and lingers. And the struggle that our members are having is that every single day is another day towards the unknown.
Instead of fear, it's become more frustration as we've continued with the second wave and the third wave. And there certainly is still fear and concern for the people that are getting COVID-19, for our community safety. But there's been a lot of frustration because we've learned so much in the first few months of the pandemic, and we knew as a society how to prevent those second and third waves, and yet that wasn't done.
Our labs are producing more tests than they ever have to try to figure out where the trending is on COVID. Our hospitals are full. Our paramedics are stretched to the limits. We need to get this under control, and we need everybody to get on side to help do it.
You know, we've watched for months through two consecutive waves now, the second and the third, as frontline healthcare workers have not only had to do their jobs, but spend their time actively advocating for this government to actually show the leadership that should have been there by default. They had to plead with Jason Kenney to bring in public health measures to restrict and cut down on the spread of COVID-19. He refused to listen until the last minute, leaving these folks who had spent months advocating to try to protect their patients and Albertans to now have to deal with the results of his lack of leadership.
In the third wave, Alberta became the worst in the country and actually the worst within Canada and the US in terms of case rate per capita. And so I think the fact that we've seen that occur really tells us that the province has failed in its pandemic response. And it's failed the health of Albertans, and it's failed the economy as well.
Yeah, my name is Joseph Koch. I work with Calgary High River. When it first started, nobody knows about it. People just hear about rumors, somebody sick, but you know what is happening. And it start to spread out the rumors that somebody is sick and this one. So it creates fear among the workers.
My name is Monique McGlellan. I work at Superstore Southport. 1574. We have quite a few people who have chosen to take time off during this pandemic because they don't feel comfortable in the store with people coming in unmasked. We haven't gotten a lot of support from the government on that at all. They think 15% or 10% of capacity is good, and that may be fine in a small retail business, but one that has 150-some thousand square feet, 10% really isn't a small amount.
I have two kids who will always ask me, how is the work today and how did you go to work, and people are afraid to go to work. And I say, and what can I do? I need to get money to pay the bills. They offer a bonus like $500 if you come to work. So everybody, even though somebody is sick, he will force himself to come because he want to get the $500. Even some people, because if you sneeze or something, they'll say, oh, you have COVID. Some people, they will try to hide their faces when they sneeze so nobody knows. Because if you sneeze, they say, oh, this guy is sick, and they will send you home. But because of those bonuses, everybody forced himself to work, which was not good.
Like, you know, you hear the stories of what our frontline workers have had to go through with COVID and going to work every day and just trying to emotionally be there for people. And that's hard. Like that's trying enough for a person. But to think that this government has had such disrespect for the work that our frontline workers are doing with COVID-19 and every other day, and to really devalue that work and turn it into monetary issues around salaries or just how they do their day-to-day work. It makes me angry.
My name is George Alanis. I was recently elected in October to be president of PQP Local 3550. We support Edmonton Public School support staff. And prior to that, I was an EA in high school. I worked as an EA for about 20 years in high school, elementary, and junior high programs. I mean, one of the things that we argue always is, and the philosophies of school boards, is that continuity of service, not disrupting the learning of students. And this was one of the most disruptive acts that could have been, decisions that could have been made.
My name is Hussein Al-Husseini. I'm 19 years old and a first-year political science student at the University of Alberta. Just because of, my limitations. I require scribing because I have fine motor issues and can't write for long periods of time. And I require reading services because I also have impaired vision, right? So when these things get taken away from you, you're left in a situation where you're kind of just struggling to get by, and to show people that you in fact know the material. It's just the matter of getting that material out into the world.
The hope that we have is to be recognized as an important group in education, an important a working group in education. We are support workers. I think many of us are realizing how essential we are.
I think there are more important things than financial budgeting, especially during a pandemic, right? You have to look at the situations, and people aren't exactly, at their full potential, at their best places right now. This is a pandemic, and instead of taking services away, you should be doing the opposite. You should be giving services. There are far more important things than the economy when people's lives are at stake. People come first.
I think one of the biggest lessons I've learned is that it's so important to have leadership that emphasizes the good of the community rather than the good of the individual.
We all just have to band together. We need to work together. I don't like wearing masks, but I wear it to protect other people and myself. Being optimistic and looking forward to the future, I think that's the easiest way through this.
Next time, when you want to elect a government, elect people who are interested in people, not themselves.
Kathy, what gives you hope for the future?
That maybe one day we'll have a government that listens to us and is concerned about not only the billionaires and the millionaires out there, but are concerned about people who work as essential workers, who work in healthcare, the public service.
We're going to get through this as Albertans, and we're going to be stronger when it's all done. And let's hope that we continue to fight to protect all those that need it the most.
What gives me hope is that the younger generation is more progressive and seems to be lifting up these ideas and spreading them on social media. And so those are the things that I'm holding on to while I'm here and staying in Alberta to fight the fight.
And I am fully confident that the next go around, people will be a lot smarter in choosing their leaders.